The global response to HIV/AIDS stands as one of the most significant public health achievements of our time. Over the past 4 decades, groundbreaking scientific research, international collaboration, and steadfast investment have transformed HIV from a once fatal diagnosis into a manageable condition. This video series highlights the critical issues facing the HIV response today, emphasizing the urgent need for continued commitment to research, treatment, and prevention. A resounding theme throughout these messages is the power of sustained investment in science and healthcare infrastructure. Decades of HIV research have not only saved millions of lives through antiretroviral therapy and prevention strategies like PrEP, but have also fueled medical advancements far beyond HIV. Breakthroughs in cancer immunotherapy, hepatitis treatment, and the rapid development of the COVID-19 vaccine are direct results of HIV research. The ability to combat emerging infectious diseases and other global health threats is deeply connected to the systems and knowledge built through these efforts. Yet, despite these successes, progress is at risk. Policy decisions that reduce funding for HIV programs and disrupt international scientific collaboration threaten to undo decades of hard-won gains. The fight against HIV has never been just about science. It has always been about people, equity, and the shared responsibility to ensure access to life-saving care for all. This series is a call to action. The world cannot afford to slow down in the fight against HIV. Continued investment in research, treatment, and prevention is essential not only for ending the HIV epidemic, but for advancing medical progress that benefits all of humanity. The work ahead remains immense, but with collective dedication, an AIDS-free future remains within reach.
Hi, I'm Sharon Hillier from the University of Pittsburgh, and I'm an HIV prevention researcher. I want to share a little story about a friend, a childhood friend, who died of AIDS. He and I played hopscotch together. We played the clarinet together. We were fast friends until he went away to move to Seattle, and I went away to college. A few years later, I was back at the University of Washington doing my fellowship in infectious diseases, and on the ward rounds, we went into a room, and who was there but my old friend Marvin, and he was dying of AIDS. I looked at him and I thought about how we had grown up in this beautiful small town together, and how he had lost his life to a virus. And I really dedicated my own life to finding prevention tools for people everywhere to use to protect themselves from HIV. And what a 30 or 40-year span it's been in prevention. We have oral PrEP, we have the dapivirine vaginal ring for women, we have lenacapavir, we have cabotegravir long-acting. And these miraculous innovations are only possible because of the investment in research and science. And yet, we live today in a world that's lost its political will to invest in science. What do we need to do? We need to talk to our family. We need to talk to our neighbors. We need to talk to people on street corners and on the planes next to us about the importance of investment in science and research, because that investment pays dividends, not only in lives saved, but investment also results in a better world for all of us, a safer world. So join me in that, and I'll look forward to hearing from you.
Hi, I'm Joey Ron. I'm a professor of medicine at the University of North Carolina in Chapel Hill. I've been an investigator in the ACTG for 25 plus years, and I'm now the principal investigator of the ACTG. And I've had the privilege, really, of working with sites all over the world. But today I want to talk to you about HIV medications in Southern Africa. In particular in a small country called Malawi, which is in the southeastern part of Africa, in the heart of Africa, as they say in Malawi. And I first went to Malawi in the year 2000, right after the Durban HIV conference. At that time, I visited the main hospital in Lilongwe, which is the capital. And in rooms that were meant for 2 people and to have 2 beds, there were 12 people bundled with blankets from home, lying on the floor, most of them remarkably thin, some of them not conscious. And most of them in that room are going to die. They're going to die of HIV and AIDS. And in the courtyard of the hospital were the families of the people that were in the hospital, because there's no food in the hospital in the year 2000. And so if you didn't have a family member come with you and bring food, you didn't eat and you would certainly die. And there were women in the courtyard, young women, thin, some emaciated, breastfeeding their babies with scared looks on their faces. And I think knowing that they're potentially passing a virus to their infant, but giving the infant the only source of nutrition that the infant had. And then if we went into the town, when we went into the town, the biggest business in the town were the casket makers. Literally on every third corner, these thin wooden boxes of all sizes, the smallest of the small up to an adult size, though none were very big because the people were so thin who were dying. And it was unbelievable. The group of us, I think, cried through most of the afternoon when we went through the hospital in the courtyard in the town. Now you go back in 2022, I went back in 2022, and 930,000 people in Malawi were on antiretroviral therapy. 930,000. That's 5% of the population were being treated for HIV. 96 or so percent of all the people that were thought to have HIV in the country in 2022 and 2023. And there were lines at the clinic, but there were lines, people who were waiting to get their medicine, people that looked healthy. They weren't thin and dying. They were talking and chatting and waiting to get their HIV medicine at the Lighthouse Clinic. It was so different. And in the hospital, in the rooms, there were beds. There were people in beds. A lot of them didn't have HIV and had other things, common things. And it was really different. HIV is still a problem in Malawi, of course, but thanks to PEPFAR and other generous programs, the health of the people of Malawi is dramatically different. I think PEPFAR is one of the greatest humanitarian acts of the American people. In fact, I think it is the greatest humanitarian act of the American people. And I hope somehow it will continue. Thank you for your time. I hope you have a great conference, and maybe I'll see you there.
Hi, my name is Doreen Muracha from Nairobi, Kenya. I want to speak a little bit about the PEPFAR funding freeze and how it has affected me as a person in the community. Well, me not directly yet, but I have seen clinics being closed. I have seen services being halted from being given. I have seen the rise of stigma. Part of the reason why I speak very boldly about my HIV diagnosis is because I want to see a reduction in stigma. Unfortunately, with what I've seen in the last few weeks, there is a lot of stigma still happening, a lot of misinformation. There is, I think we've gone back to looking at HIV from a death sentence point of view, while we worked for over 4 decades to destigmatize HIV and say it is not a death sentence. So there is, this PEPFAR funding freeze has taken us a few steps back. And I know that it is overwhelming, not even can be, it is very overwhelming that this is not just about pandemic. This is about a lifelong epidemic that we've lived with that has not found a solution yet. So you can't just pull funds in the middle of the highway and say, hey, no, we have to do other things. No, because that is putting people's lives at risk. That is ensuring that children are still being born with HIV, just like I was, because there was no treatment. So it's time to actually prioritize the lives of people, because these are our lives on the line. That if I go to a clinic and be reminded of 8-year-old Doreen being sent home to get taken care of and laughed because I was about to die is not a very good look. It creates so much trauma. It brings up so many hidden wounds, and it means that you're being insensitive towards the lives of people. So I would love for us to put people's lives first. I would love for us to look at the aspect that money is important, but so is human life. Thank you so much.
My name is Peter Hunt, and I'm a professor of medicine at the University of California, San Francisco. I lead a research program that seeks to improve the health of people with HIV around the world. Today, I wanted to speak out in support of the PEPFAR and interlinked USAID programs. PEPFAR was started by President George W. Bush in 2003 to support the HIV treatment in low and middle income countries around the world. At the time, tens of millions of people had died from AIDS in sub-Saharan Africa, and the virus was spreading unchecked. I witnessed this firsthand. I was working in Kampala, Uganda in the fall of 2004, just before and after the first PEPFAR drugs arrived. When I first got there, coffins literally lined the roads from the airport to the city. Death from HIV was everywhere. The clinic where I was working would see 300 people with advanced AIDS every day, most of whom had just 1 or 2 months left to live, and there was nothing we could do. But I will never forget what I witnessed after the first PEPFAR drugs arrived. The clinic population literally doubled in size in just 1 month, simply because people were living. And over the last 22 years, the PEPFAR program has gone on to save 25 million lives around the world. And because of the outstanding work of partners in USAID, the program has been run incredibly efficiently, spending under $200 for every year of human life saved. As Americans, we should be extraordinarily proud of this program. And right now, these programs are being threatened. We estimate that there have already been over 20,000 deaths from the hobbling of the program in recent weeks. If the program were to end, the 20 million people with HIV who rely on it to remain alive would start progressing to AIDS again, and we would experience an explosion in new HIV infections around the world as the virus starts spreading again to other people. We cannot let this happen. Please join me in standing up for PEPFAR and USAID.
Hello, I'm Mary Fisher. You might remember me from my keynote address to the 1992 Republican Convention. When I mounted the stage that evening, I had 2 small sons on their way to becoming orphans. My life expectancy was short. Thanks to medical miracles, I'm alive today. I've seen my preschool sons grow into adulthood, and I'm a grandmother who treasures cuddling 3 preschool grandchildren. Research into AIDS has literally taken us from death to life. It's made me a thankful grandmother, cuddling silly grandchildren. And this one disease is not the only beneficiary of AIDS research. Discoveries by AIDS researchers have taken on a host of childhood and adult cancers and other diseases. When COVID-19 swept over America, AIDS research accelerated discovery of effective interventions and brought COVID to its knees. The vast majority of American people support government funding for medical research and care. I'm one of them because I know that if funding is starved, research will stagger to a stop. And when research stops, we pay the cost in lives, in dollars, and in hope. No research, no discoveries. No discoveries, no miracles. No miracles, no cuddles.
Hi, I'm Kevin Bowen, Scientific Program Director for CROI at IAS-USA. When we talk about the HIV/AIDS pandemic, we often focus on the millions of lives saved through treatment and prevention. But for me, when I think of this global crisis, I think of my friend, Tom Furlow, one of the kindest, most remarkable people I've ever known. Tom confronted HIV in the early 1990s, in the days before the treatment and prevention options of today existed. Tom refused to surrender to despair. Instead, he chose to fight not just for himself, but for the future by becoming a study participant. His courage and willingness to contribute, combined with the work of many others, helped pave the way for the medical advances that have saved millions. Though we lost him in 1994, his legacy lives on in every breakthrough, every life extended, and every new possibility created through research. The work is far from over. Progress depends on an unwavering commitment from scientists, healthcare providers, the public, and most importantly, from our government. Research is not just a scientific endeavor, it's a moral imperative. It requires bold investment and unwavering support because, at its core, research is about saving lives. And there's no greater obligation than that.
I'm Diane Havler, a physician, a clinical scientist, and professor at University of California, San Francisco, and have dedicated my career to HIV. I worked on the first studies of medications to treat HIV. At this time, AIDS was cruelly taking the lives of persons all around us. After a series of setbacks in our research, I vividly remember the day that the data came across the fax machine showing that 3 drugs could block HIV. I thought, everything in this disease is going to change, and it did. HIV treatment gives persons a normal life expectancy, and treatment stops transmission, including to babies. The United States took these treatments global with the PEPFAR program established by George Bush in 2003. This highly successful and ongoing program is bipartisan, science-based, and efficient. It has already saved 25 million lives, stopped the exponential spread of HIV, and stabilized societies and economies. But HIV is far from over. 40 million people are living with HIV around the world and needing treatment. And there are still over 1 million new infections every year. And we cannot cure HIV yet. We need to continue investments in science and in programs like PEPFAR that apply the science. If we take away funding for programs like PEPFAR, it is estimated that in the next few years, there will be in excess of 9 million new infections, 6 million deaths, and will be 3 million more orphans. This makes absolutely no sense. We need to support science. We need to support PEPFAR. This is where we in the United States can shine.
Greetings. My name is Connie Callum. I'm professor of global health medicine and epidemiology at the University of Washington. I started my career as a physician in San Francisco in the 1980s, where I witnessed the early and very grim days of AIDS. Since then, we've had 2 big game changers. One was highly effective antiretrovirals for treatment, which now allow people to have a normal lifespan with a pill a day, or in some cases injections, as well as with HIV medications that can block HIV infection. I will never forget the day in July 2011 when our study of a once-a-day pill for HIV prevention was stopped early because of such high efficacy that it was no longer ethical to have a placebo arm. This concept called pre-exposure prophylaxis, or PrEP, really works. That first generation of PrEP blocked 75% of infections. Current versions in injectable form can block up to 100%. This is an incredibly powerful tool, and PEPFAR has made both treatment and prevention available to millions of people around the world. It is hard to fathom the idea of taking 4 decades of progress and stalling it out because of a policy change in access to treatment and prevention. We cannot let this happen.
Hello, my name is Raj Gandhi. I'm a HIV clinician and researcher at Massachusetts General Hospital and Harvard Medical School. It is wonderful to be together with the community of HIV researchers and clinicians here at CROI 2025. As I think back on the past 30 years since I entered the field of HIV, I am struck by how much progress has been made. When I was a medical student in the late 1980s, HIV/AIDS was uniformly fatal, and there was almost nothing we could do to prevent progression. In the span of my career, HIV/AIDS is now a treatable and preventable infection, and people around the world with HIV are living long and productive lives. HIV research has led to insights into other conditions that occur more commonly in people with HIV, conditions such as heart disease, cancer, and premature aging. And HIV science has informed the development of revolutionary medical advances such as cancer immunotherapy. All of this amazing progress is because of the many people represented here at CROI, researchers, clinicians, policymakers, and the community of people living with HIV, all working together to improve the treatment and prevention of this infection. And the incredible accomplishments are based on investments from NIH and research funders and support from organizations that fund global HIV efforts like PEPFAR. I hope that in the years to come that we can build on all of this progress, and with sustained investment in research and global health, I am certain that we will end HIV here in the United States and around the world. I look forward to being together with you at CROI, and a wonderful meeting to all of us. Thank you.
Hi, my name is Judith Currier, and I'm a professor of medicine at the University of California in Los Angeles. And I've been involved in HIV research for over 30 years. And I think it's really important for people to understand all the benefits the investments in HIV research have had for other areas of science. And one example is the development of the initial drugs to treat HIV that were protease inhibitors. This work really helped facilitate the development of drugs for other diseases like hepatitis C, which we can now cure. This is an incredible development that's helping people around the world and lowering the risk for long-term liver failure and liver transplants. The investments that have been made in HIV have paid off in so many ways.
Hi, my name is Stephen Deeks. We're all aware of the great advances that have been made in the prevention and treatment of HIV. This is all directly tied back to the massive amount of investment that the NIH and others have made in HIV science going back to the 1980s. What I want to talk about here, real briefly, is how those investments have had a huge impact outside of HIV. Just as an example, back in the mid-1990s, I was approached by a group of scientists who were developing novel ways to genetically re-engineer CD T cells. This eventually became CAR T cells. We did the first really controlled study of this approach done anywhere. Did not work for HIV, but everybody involved in that effort, except for myself, left quickly from HIV and went on to make great advances in cancer and now immunotherapy. And many actually are coming back to try to help us cure HIV. Other examples of how the HIV investment led directly to major advances outside of HIV include treatment of hepatitis B, the cure of hepatitis C, prevention of sexually transmitted diseases, cancer immunotherapy, mainly the PD-1 inhibitors that are now having huge effects in the world of cancer were developed in preclinical models using HIV medicine and HIV models back in the day. Global health, our ability to distributed chronic medications for HIV globally has led to novel ways to do this for other areas of medicine. And the list goes on and on. Probably the best example, of course, is COVID. Back in January 2020, a group of HIV vaccine experts got a hold of the sequence for SARS-CoV-2 and very quickly developed what became the COVID vaccines. Probably neutralizing antibodies that are now being developed for HIV. That technology was quickly modified to develop antibodies for COVID, antivirals for COVID, and so forth. So many examples of how the NIH investments, which have been generous for HIV, have led to major advances outside of medicine. And it's ongoing. Right now, there's a big effort to use in vivo gene editing, gene delivery to cure HIV. That work is based on and feeding back to global efforts to treat other chronic diseases, sickle cell disease, for example. And so I think as we all attend CROI and are aware of what's going on in terms of the global investments, particularly from NIH elsewhere in HIV, we're, of course, very appreciative of that, but we should also acknowledge that these investments have had massive collaborative benefits throughout medicine, and I'm sure it will continue. Thank you.
Science begets science. What do I mean by that? Discoveries made in one area oftentimes lead to important discoveries in other areas that we couldn't even imagine at the time. Prime example, the development of a COVID vaccine in 11 months. 11 months. Usually it takes 11 years to go from concept to approval of a vaccine. This was done in 11 months, and it's all on the shoulders of work done in the field of HIV for decades, looking for an HIV vaccine. And all the people who had been working on that came together in a very short period of time and created a candidate vaccine and used the networks already established by NIH for the development of a HIV vaccine, everyone working together, Operation Warp Speed, and voila, a COVID vaccine. All because people worked together, they were generous, and their eyes were on the future of trying to find a way to respond to a global pandemic that we can now manage very well with a successful COVID vaccine.
I'm Jim Hoxie from the University of Pennsylvania. I've dedicated my career to AIDS research and served on the CROI Program Committee for many years. I've been an AIDS researcher since the very beginning of the pandemic, including the 3 years before HIV was discovered. Looking back over the last 40 years, I am in awe of how far we've come. In the early days, a diagnosis of HIV infection was a death sentence. There were no treatments, and the morbidity of this disease was staggering. The virus challenged us at every turn as it revealed its life cycle, novel genes, and mechanisms of pathogenesis we had never encountered before. But today, arch suppression of HIV to undetectable levels is possible. Long-acting treatments can prevent infection for months, and potent immune responses have been identified that provide signposts for an effective vaccine and possibly a cure. Progress has often been incremental, with breathtaking advances and heartbreaking setbacks, but it was made possible by a resilient and determined, collaborative and global scientific community, always striving to do more and to be better. At the heart of this progress has been the National Institutes of Health. Through its funding, its rigorous peer review process, and its support for intra- and extramural research, NIH has laid the foundation for every major advance in AIDS science, and it has fostered and inspired new generations of scientists to take on the next set of challenges. But we need to appreciate that the transformative progress we have seen in AIDS research is not self-sustaining. The institutions that have driven discoveries, NIH and the broader scientific community, must continue to be supported. When we invest in science, we don't just save lives today, we build the foundation for the breakthroughs of tomorrow.
Hello, my name is Katie Barr, and I'm an infectious disease doctor and a translational HIV researcher in Philadelphia, Pennsylvania. I have been working in HIV care and research for about 25 years, and I have watched discoveries move from basic research to clinical trials to being available to patients in my clinic here in Philadelphia and throughout the entire world. I have witnessed the modern miracle of HIV becoming a manageable chronic illness. Much of my work is collaborative with partners at my university, at other schools in the US and globally, and importantly, with US governmental agencies. I cannot overstate how essential federal funding of every step of this process is. The current freeze on government funding and the firing of essential government workers threatens all of these amazing accomplishments, and it truly limits what we can hope to accomplish in the future. I am very excited to be here at CROI to hear the new science that will be presented. But I know in order to maintain these gains and develop new therapies, preventions, and cures for HIV and other diseases, we must protect federally funded U.S. biomedical research. Thank you.
My name is Jean-Michel Molina. I'm a professor of medicine at the University of Paris in France, and I'm also the chief of the Department of Infectious Diseases at the St. Louis and Lariboisière hospitals in Paris. I've done part of my training in the US, and I'm very grateful to my US mentors who introduced me to the best science and who also showed me the critical value of international cooperation. Indeed, science has no borders. The recent executive orders by the Trump administration to stop international aid, to withdraw from international institutions, and to halt research funding both in the US and abroad have affected the lives of millions of people. These are bad decisions for science, bad decisions for the future of humanity. The impact on our US colleagues has been tremendous. We as Europeans stand firmly at the side of our US colleagues, all international researchers, and all people whose lives have been jeopardized by these decisions, which must be quickly reversed.
Françoise Barré-Sinoussi, Nobel laureate. Dear colleagues and friends, today we are deeply concerned about the decision of American administration and their potential impact on science and on global health. Science has proven that only together can we overcome pandemics and global health challenges, as we learned from HIV and COVID-19. There are many good examples of the effectiveness of joining forces in HIV science, thanks, for example, to the work performed by American, French, African, and Asian researchers supported by the NIH and ANRS on prevention of HIV transmission in mother to child and in key population using antiretroviral and using PrEP. Weakening research, cutting funding, and ignoring international cooperation are dangerous for the entire world, including America. We must stand united, mobilized, and committed to protecting science and public health. The world is watching, and history will remember.
Yazdan Pana, the director of ANRS Emerging Infectious Diseases. Today, close partnerships between American, French, and other international scientists contribute to fight against global threats in infectious diseases. Recent US policy decisions jeopardize these essential scientific links precisely when global cooperation is most needed to combat emerging infectious diseases, including those threatening the US. The health challenges, particularly pandemics, that the world will face require a coordinated global response, with the United States playing a crucial role.
Hi,
I'm Rafi Landovitz from the Division of Infectious Disease at the University of California, Los Angeles. I also serve as the director of the UCLA Center for Clinical AIDS Research and Education. Throughout my career, I've focused on research and clinical care that has tried to optimize the use of anti-HIV medications for both HIV treatment and HIV prevention. The recent cuts in international aid in support of HIV programs globally are devastating to all of our efforts. I think many of my colleagues have taken the opportunity to comment on the effects on treatment, quality of life, and longevity for people living with HIV. I want to take a moment to comment on the effects on prevention. The current limited allowances for United States foreign aid to support biomedical HIV prevention are limited to women who are pregnant or breastfeeding. While these are incredibly important populations to protect against HIV acquisition, those limitations only serve to further stigmatize other key populations who might be exposed to HIV, and this is unacceptable. We absolutely have all of the HIV prevention tools we need to globally end the HIV pandemic. The question remains whether we have the financial resources, the political will, and the collective agency to accomplish that goal. These cuts in U.S. foreign aid are a devastating setback against these critically important goals.
My name is Nicolas Chaumont, and I'm an immunologist at the University of Montreal, where my lab is dedicated to advancing the search for a cure for HIV. Like many of my American colleagues, I am deeply concerned about the recent actions taken by the US government, particularly regarding the PEPFAR program. PEPFAR has saved millions of lives and prevented countless HIV infections in both adults and newborns. Its potential dismantling is ethically unacceptable and could reverse decades of progress in the global fight against HIV. Life-saving drugs are developed by scientists trained in academic institutions with crucial support from NIH funding. The brilliant minds behind treatments for infectious diseases, cancer, and cardiovascular diseases have all benefited from the mentorship and systems that lie at the heart of academic research. The US government's long-standing investment in academia has not only advanced knowledge, but has also delivered immeasurable returns in the form of lives saved and suffering alleviated. By restricting resources to universities, we are jeopardizing the next generation of scientists. The question we must ask ourselves is, who will discover the cures for tomorrow's diseases if we do not protect academic research today? As scientists and citizens, it is our duty to defend what is best in our societies, the transfer of knowledge to cure diseases and the solidarity with those affected. We have a moral responsibility to safeguard the integrity of academic research for the benefit of all.
Around $6 million have come each year to Thailand through USAID. My name is Nitya Panupak, and I'm the Executive Director of the Institute of HIV Research and Innovation, or IAS-USA, which is based here in Bangkok, Thailand. Over the past 10 years, we, as a group of community-led organizations, has established the community-led health services with now more than 600 lay providers being trained and qualified to provide HIV testing to more than 60% of all HIV testing each year in the country, and also to give out oral PrEP to more than 80% of current PrEP users, as well as to provide gender-affirming care to trans and gender-diverse people of around 10,000 clients each year in Thailand. And during these past 10 years, data from these direct service deliveries were used to advocate for policy change, for PrEP, for HIV self-testing, for gender-affirming care, to successfully or almost successfully included under our Thailand's universal health coverage for all Thai citizens. But after these past 10 years, we as community-led organizations, we still need to exist to keep fighting with our government to make them agree that the government money, which is paid by our tax, must be used to pay to us who deliver these services. We will not let the country take it for granted anymore for the services that we deliver and pretend not to know that we cannot survive without the replacement of USAID money. Trump's executive orders are so cruel. But what is even more heartless is our government, who has not yet reached out to any of us now, 44 days after the announcement of those stop work orders. But we are still here. We will keep fighting, and we will survive. Thank you very much.
Hi, I'm Luciana Camil. I'm a community advocate in Brazil. AIDS is not over. And over the past 2 months, we have witnessed a disturbing dismantling of a 40-year global effort to eradicate AIDS, marked by a significant cuts in humanitarian aid for HIV. While science has opened up new avenues for HIV prevention and treatment, we continue to strive toward a cure. Global collaboration has brought us closer than ever to progress. Both science and communities most affected are now under attack from conservative policies. Don't forget, the censorship of science conceals critical risk and hampers our ability to prevent new epidemics. The only way to address this is by embracing the power of the science, strengthening community engagement, and fostering effective partnership through a robust public policies. The fight against the HIV epidemic is shared by a responsibility. It knows no borders and involves all communities, uniting humanity as a whole. This struggle is not only for those most affected, but for all of us. We cannot be truly safe until everyone is safe.
My name is Hyman Scott. I'm in the San Francisco Department of Public Health. I'm an HIV provider and an HIV prevention researcher focused on PrEP. HIV research has led to multiple options for PrEP and have reduced HIV infections by 50% or more in places where it's offered, accessible, and affordable. We've been fighting HIV for more than 40 years, and we know that it's more than just a virus. It's about how the society and our communities respond to the virus. And our efforts to end the HIV epidemic are dependent on our societies and our communities responding to support those who are living with or affected by HIV. Our current policies are moving backwards in that respect, and we are at risk of losing the ground that we've made in HIV prevention and care in the U.S. and globally. We really need to focus our efforts on expanding, not contracting, our HIV prevention and care services for people so that we can really achieve our goal of an AIDS-free society.
This is Tony Fauci. I'm a distinguished university professor at the Georgetown University School of Medicine and the Court School of Public Policy. Over the past 40 years, the advances in basic and clinical research on HIV/AIDS have been nothing short of breathtaking. The implementation of these advances in treatment and prevention have saved countless lives. These accomplishments have been historic in their impact. However, we are not finished yet with HIV/AIDS. We must continue and accelerate support for further scientific advances and at the same time ensure that the fruits of these advances in treatment and prevention are equitably distributed. We can end the global HIV epidemic. We have the resources to do so. Now is not the time to pull back, for history will judge us harshly if we squander the opportunity that is before us.
Hello and welcome to San Francisco to CROI 2025. My name is Carlos Del Rio and I'm an HIV researcher at Emory University School of Medicine at the Emory Center for AIDS Research. I want to talk to you about why global HIV research is so critically important. And 1996, after the development of highly active antiretroviral therapy, people in the US and Europe and Australia started surviving, yet people in many other countries like Sub-Saharan Africa and in many places around the world continued to die as a result of HIV. And it was the leadership of President George W. Bush, aided by many others, that designed PEPFAR. And PEPFAR, since then, has really provided life-saving therapy and has transformed the life of many, many people. Over 25 million people have been saved as a result of PEPFAR. Over 5 million children have been born free of HIV infection as a result of PEPFAR. And more importantly, the economies of those countries and the security of those countries has been strengthened. So losing PEPFAR has enormous consequences, not only for individual lives, but also for the economy of those countries, for the safety of those countries, and for the security of the United States. Furthermore, the United States through PEPFAR, has had enormous goodwill globally. And the soft power that PEPFAR has really been transformative in many places around the world. In Sub-Saharan Africa, the people are thankful for the work of the United States. So getting rid of PEPFAR basically deletes all that and puts us at high risk going forward. If you can do one thing, is call your congressperson and say, do not end PEPFAR. Please reauthorize it for the next 5 years. Thank you very much.
HIV is a virus that kills everyone. Literally everyone without treatment dies of HIV. And we've seen that happen. We've lived through the bad parts of this epidemic. In the last 10, 15 years, we, scientists, physicians, community level people, have created treatments that have saved millions of lives. Millions of people are on treatments across the world that are keeping them alive. If those treatments stop, we know what happens. The virus comes back and people will die. So by taking away funding, PEPFAR especially, we run the risk of seeing literally millions of people die. More will die than died from the Holocaust. This is something that we can prevent. We can prevent this by continuing to support the humanitarian efforts of PEPFAR through USAID and other programs. This is something that should not be even a point of discussion. This is something that's really in our power, and we need to get together and make sure it happens. Thank you.
My name is Dawn Averett, and I am the founder of an organization called the Well Project that serves women with HIV and AIDS around the world. I'm also a mom and a longtime AIDS treatment activist and a woman living with HIV for more than 37 years now. I am truly a beneficiary of great science and research over the years. It has allowed me to become a mother and even to do the work that I do on a daily basis. I keep having these conversations these days with people who really, truly don't understand the role and the impact of both the science and the research, but also the leadership from the U.S. government and, frankly, the generosity of the American people in keeping people healthy and well and ultimately safe. I feel like we've missed an opportunity to understand one another and how incredibly interconnected we really truly are. There is not a person in the entire country who has not benefited from the extraordinary research and science that goes on in this country. Whether you've had a parent with Alzheimer's or a friend or relative with breast cancer or a kid that's been dealing with mental health issues or you've had to live with HIV. Everyone in this country has benefited from the extraordinary science and research that goes on here. The reason that we were able to have a vaccine for COVID so quickly was that all of that foundational research had already been done, that we didn't just start when COVID showed up in the world and then on our shores. Our role in this country as a leader has been to continue to fuel the fires of inquiry, to continue to build a base of information and not only science, but scientists and researchers who give us all ultimately better lives. I hope that as we fight back over the days and weeks and months ahead, more and more people will stop and ask themselves, how has research or science impacted my life or my family? I can tell you that when I was diagnosed with HIV in 1988, I had 6 months to live. Now I have 3 beautiful daughters and a robust and healthy life where I give back to the community in important and meaningful ways. That would have never been possible without people in labs understanding the virus and the opportunities to improve all of our lives.
Hi, my name is Mary Fisher. Since 1992, when I spoke at the Republican National Convention, I've been called an AIDS activist. As a special representative, I've traveled the world on behalf of American ingenuity, science, and compassion. Through the vision of heroes like General Colin Powell and President George Bush, more than 25 million lives have been spared that would otherwise have been lost to AIDS. Science has brought us drugs that offer life to men, women, and children otherwise headed to an early grave. In Africa and elsewhere, what challenges us most is access. How those in need of the life-extending drugs can actually secure them. When the issue is access, the greatest barrier to access is poverty. USAID has brought more than money. It's brought access and life to millions. People I've dined with, sung songs with them, danced with them. Nothing has brought more access and more hope than USAID. No wonder my phone has been ringing. Is it true, my African callers want to know, that we are being abandoned? In my restless sleep, I hear the terrible question they're too kind to ask. Do you plan to live and let us die? What do you think I should say? Do I tell them that their lives are less valuable than mine? Do I explain that we have enough knowledge and enough resources to spare their lives, that what we lack is enough compassion? What do you think? Do I tell them that we just don't care?